All right, let's dive into a world that's usually invisible, but it has a huge impact on our lives.
Infectious diseases. Yeah.
Exactly. We're talking bacteria, viruses, parasites, the whole microscopic crew.
A world full of unseen enemies.
That's a great way to put it.
Yeah.
And you've sent over this really detailed medical text.
It is a big one.
It is. So our mission today is to break it down, and hopefully you can walk away feeling like you've got a solid grasp on these unseen enemies, their causes, symptoms, how to treat them, how to prevent them. Think of it as your crash course in everything from the common cold to, well, things you definitely don't want to catch.
What I think is so fascinating about infectious diseases is how much they've shaped human history.
Oh, absolutely.
And they continue to challenge us even today. Like we always think we're ahead of them, but they always seem to find a way to adapt.
They always adapt.
And as you mentioned, this text is packed with information. It really goes deep into the mechanisms of these diseases.
It does.
So are you ready to jump in?
Yeah, let's jump in. Okay, let's start with something I think we've all experienced.
What's that?
Fever. I mean, we all know it's a sign that something's up, but what's really going on in our bodies when our temperature spikes?
Well, it's actually a really brilliant defense mechanism. You see, when those microbes, those pesky invaders get into our system, our immune system sends out these chemical signals.
Like a little alarm system.
Yeah, exactly, like a little alarm system. And these signals are called pyrogens. And these pyrogens tell the brain to turn up the heat, literally. This higher temperature, what it does is it can slow down the growth of those invaders, those bacteria and viruses, and it gives our immune system a fighting chance.
So it's like our body's internal furnace is firing up to fight those bugs.
That's a great way to think about it. It's like our body's own little internal battleground.
That makes sense. But I've also heard that a really high fever can be dangerous.
Absolutely. While a mild fever is usually beneficial, a fever above 106.8 Fahrenheit can actually cause irreversible brain damage.
Yeah, I didn't realize it was that high.
Yeah, it's serious. And this really highlights a crucial point. Fever severity isn't always a direct indicator of how serious the infection is. You could have a low-grade fever and still be battling something significant.
That's a good reminder to, always pay attention to those fevers, even if they seem mild.
Absolutely. Never ignore a fever.
Speaking of mysteries, this text mentions something called fever of unknown origin. It sounds like something out of a spy novel.
Right. Fever of unknown origin, or FUO, that's what we call it in the medical field.
Okay, FUO.
FUO, it's diagnosed when a fever persists for more than a week, even after, extensive testing. We've done all these blood tests, scans, everything, and we still can't figure out what's causing the fever.
So it's a real medical mystery. Like they're trying to figure out who doing it, but it's a fever.
It's like a medical detective story trying to uncover the culprit behind the persistent fever.
So what are some of the usual suspects in these FUO cases?
Well, infections are always on the list, right? But it can also be caused by things like connective tissue diseases.
Connective tissue diseases, what are those?
These diseases affect the tissues that kind of hold our body together. And then there's also, the more serious possibility of malignancies like lymphoma.
Lymphoma, that's a type of cancer, right?
Yeah, a type of cancer that affects the lymphatic system.
Wow. So it sounds like it can be a real challenge for doctors to pinpoint the cause of FUO.
Oh, it definitely requires a thorough investigation. Doctors will, take a very detailed history, perform a physical exam, order blood tests, analyze urine. They'll really leave no stone unturned. They'll try everything to find the source of that fever.
Really digging deep. Speaking of fevers and infections, let's talk about a condition that can turn deadly really fast. Sepsis.
Sepsis, yeah, that's a big one.
This one always sounds so scary to me. Like you hear about it and it's just like this really serious, scary condition.
Sepsis is a life-threatening condition, and it occurs when the body's response to an infection kind of spirals out of control.
Spirals.
Yeah, it goes into overdrive, and in the process, it ends up damaging its own tissues and organs.
So the body's trying to fight the infection, but it's almost like it overreacts.
Exactly. It's like an overreaction of the immune system, and it ends up causing more harm than good.
The text also uses the term septicemia. Is that the same thing?
Septicemia specifically refers to the presence and multiplication of bacteria in the blood.
Okay, so that's like a specific component of sepsis.
Right. It's a key component of sepsis, but sepsis encompasses a broader spectrum of, physiological derangements.
And I've read that sepsis cases are on the rise. What's driving this increase?
Well, there are a few factors at play here. One is the growing problem of antibiotic resistance. The overuse and misuse of antibiotics have led to the emergence of superbugs that are much harder to kill, and this makes infections harder to control, and it increases the risk of sepsis.
So those antibiotic-resistant bacteria are making it tougher for our bodies to fight back effectively.
Yeah, exactly. They're like tougher opponents, so to speak.
Okay.
And then another factor is the increasing use of invasive medical procedures.
Invasive medical procedures, what do you mean by that?
Any procedure that breaks the skin barrier, like surgery or inserting a catheter, these procedures create a potential entry point for bacteria into the bloodstream.
Right, because they create an opening.
Exactly.
And what's really alarming is that the text mentions a mortality rate for sepsis as high as 50%. That's really high.
It is alarming, and that's why early recognition and treatment are absolutely critical. We need to be able to spot the signs and act fast.
So what are some of the red flags? Like, what should people watch out for that might indicate that they're developing sepsis?
There are a few key things. Fever is often present, but sometimes, the body's temperature regulation can be disrupted, and you might even see a low body temperature.
Really?
Yeah. And other signs include changes in mental status, like confusion or disorientation, difficulty breathing, a rapid heart rate, and low blood pressure.
So those are all signs that something's seriously wrong.
Exactly.
The text also mentions SIRS, Systemic Inflammatory Response Syndrome, as a diagnostic element. What exactly is SIRS?
SIRS is basically a set of clinical criteria that help us identify patients who are experiencing a widespread inflammatory response.
Okay, like a set of symptoms they look for.
Right. It's not specific to sepsis, but it can be a red flag that warrants further investigation.
So if sepsis is suspected, what happens next?
Well, doctors will typically order blood cultures to try to identify the specific bacteria causing the infection. They might also use imaging studies, like CT scans, to look for any organ damage. And another important test is checking lactate levels.
Lactate levels, what do those tell us?
Lactate levels can indicate how well tissues are being supplied with oxygen. High lactate levels can be a sign that things aren't going so well.
So it's a sign that the body's not getting enough oxygen.
Exactly.
That's a lot of information to process. But it highlights just how serious sepsis can be.
It really is a condition that demands prompt and aggressive treatment. The immediate priorities are securing the airway, ensuring adequate circulation, and starting broad-spectrum antibiotics to target those bacteria. And of course, we need to identify and address the root cause of the infection.
So you got to hit it hard and fast. Okay, now that we've covered the basics of fever and sepsis, let's zoom in on some specific bacterial bad guys, some of the culprits behind these infections. And I think a good place to start is with the infamous Streptococcus.
Oh, Streptococcus. It seems like this bacteria is responsible for a whole host of infections.
It really does. It's like the king of causing trouble.
Streptococcus is actually a whole genus of bacteria that can cause a wide range of illnesses. They're incredibly common, and they come in, various forms, some more troublesome than others.
The text mentions that they're classified based on something called hemolytic properties, like alpha, beta, or gamma. What does that even mean?
So these classifications describe how the bacteria interact with red blood cells.
Red blood cells, okay.
Beta hemolytic streptococci, particularly group A, those are the ones we worry about most. They're responsible for some of the most common and potentially serious infections.
Like strep throat.
Mm-hmm.
I think we've all had the displeasure of experiencing that at some point in our lives.
Yeah.
That sore throat is no joke.
Ah, yes. Strep throat, also known as pharyngitis. It's a classic. You get hit with a sore throat, fever, swollen lymph nodes. It usually comes on pretty suddenly, and it can really knock you down.
Yeah, for sure. And then there's that strep throat variant that comes with a rash, scarlet fever.
Scarlet fever.
The text describes it as feeling like sandpaper.
Oh, yeah. Scarlet fever can be quite distinctive with that sandpapery rash and a strawberry-like appearance of the tongue.
Strawberry tongue.
Yeah.
Yeah.
It's pretty unique, but thankfully it's usually treated effectively with antibiotics, just like regular strep throat.
That's good to know. What are some other streptococcal infections that we should be aware of?
Well, there's erysipelas. That's a skin infection that causes a painful, fiery red rash with distinct borders.
Sounds unpleasant.
It is. And it often appears on the face, which can be quite alarming.
And pedigo, does that one ring a bell?
Impetigo, yeah. It's highly contagious, especially among kids. It causes those honey-colored crusts that are hard to miss.
Yeah, remember that.
Thankfully, topical or oral antibiotics usually clear it up.
The text also mentions cellulitis, like a deeper skin infection.
Yeah, cellulitis can be pretty painful. And then there's necrotizing fasciitis.
Oh, necrotizing fasciitis.
Yeah, that one always Sends chills down my spine.
That's the flesh-eating bacteria, right?
That's the one. It's definitely one of the most severe infections caused by Streptococcus. Thankfully, it's rare, but it's incredibly serious because the bacteria can rapidly destroy tissues.
It can spread really quickly.
Very quickly?
It's a stark reminder of just how powerful these tiny microbes can be.
They really are.
And we can't forget about toxic shock syndrome. That's another life-threatening illness that's linked to certain bacterial strains.
Toxic shock syndrome can progress rapidly, and it can affect multiple organ systems.
Wow. So it sounds like early diagnosis and treatment are crucial for any suspected streptococcal infection.
Absolutely. Early diagnosis and treatment can prevent these kinds of complications.
Speaking of complications, the text mentions rheumatic fever and glomerulonephritis. What are those exactly?
Rheumatic fever is an inflammatory disorder that can develop after an untreated strep throat infection. So it's really important to treat strep throat properly.
So that's why they always give you antibiotics for strep throat.
Exactly. They want to prevent rheumatic fever because it can damage the heart, joints, skin, and even the brain.
Wow.
And glomerulonephritis, that's an inflammation of the tiny filters in the kidneys called glomeruli, and it can lead to kidney damage if it's not addressed properly.
So again, it's a consequence of untreated strep throat, emphasizing the importance of taking those antibiotics as prescribed.
Exactly. Take those antibiotics.
Finish the course. The text also mentions something called the Jones criteria for diagnosing acute rheumatic fever. What's that all about?
The Jones criteria are basically a set of guidelines that doctors use to diagnose rheumatic fever. They look for a combination of major and minor criteria to make the diagnosis.
Okay, so it helps standardize the process.
Right. It helps standardize the diagnostic process so we can catch it early and intervene effectively.
Okay, let's shift gears to another bacterial foe. But this one packs a serious punch with its toxins. Clostridium botulinum. Just hearing that name makes me think of those scary warnings on food labels.
Botulism, yeah. It's a rare but potentially fatal illness caused by one of the most potent neurotoxins known to humankind.
The text explains that this toxin works by interfering with nerve signals.
It blocks them.
Yeah, blocking them, leading to paralysis. How does that actually happen in the body?
Imagine your nerves as these communication lines that send messages from your brain to your muscles.
Okay, yeah, like little wires.
Yeah, like little wires. Well, botulinum toxin basically cuts those lines. It blocks the release of acetylcholine, which is a neurotransmitter that's essential for muscle contraction.
So the muscles can't get the message to contract.
Exactly. And that leads to muscle weakness and paralysis.
And this can have life-threatening consequences, especially if the muscles involved in breathing are affected.
That's right. If you can't breathe, that's a big problem.
The text mentions different forms of botulism. What are those?
The most common form is foodborne botulism. It results from consuming food that's contaminated with the botulinum toxin. This often happens with improperly canned or preserved foods.
Like those hung canned goods that haven't been properly sterilized?
Exactly.
And what about infant botulism? I remember hearing about that.
Infant botulism occurs when babies ingest spores of the bacteria, and those spores can germinate in the gut and produce the toxin.
Okay.
That's why it's absolutely crucial to avoid giving honey to infants under 1 year old.
Honey?
Yeah, because honey can be a source of those spores.
So no honey for babies. Good to know. What are the other forms of botulism?
We have wound botulism, which occurs when the bacteria infects a wound, and iatrogenic botulism. That's a rare complication of medical procedures, usually related to injections.
Wow, so botulism can come from a variety of sources.
Yeah.
What are the typical signs and symptoms to watch out for?
Well, the initial signs are often visual disturbances, like double vision or blurred vision. And then this is followed by difficulty swallowing, speaking, and muscle weakness. And eventually this can progress to paralysis, including paralysis of the respiratory muscles, which of course can be life-threatening.
That's terrifying. What happens if someone does develop botulism?
It's a medical emergency. It requires prompt treatment. Fortunately, we have an antitoxin that can neutralize the toxin if it's administered quickly enough. Treatment also involves supportive care to manage respiratory failure if it occurs. So that might involve mechanical ventilation to help with breathing.
So that's like a breathing machine.
Exactly.
Okay, next up is another potentially deadly bacterium, Bacillus anthracis, better known as anthrax. This one always sounds so ominous.
Anthrax does have a rather ominous reputation. It's a spore-forming bacterium, and it primarily affects animals, but it can be transmitted to humans.
The text mentions that it's found in animals like sheep, cattle, and horses. How do humans typically get infected with anthrax?
There are a few ways. Cutaneous anthrax is the most common form. That occurs when the bacteria enters the body through a cut or abrasion in the skin.
So like if they're handling infected animals.
Exactly, often from handling infected animals or animal products.
Okay, so farmers or people who work with animals are at risk. What about the other forms of anthrax?
Inhalation anthrax is the most dangerous form. That one occurs when someone inhales anthrax spores.
Inhales the spores.
Yeah, and this can happen if they're exposed to contaminated animal products or in rare cases through a bioterrorism attack.
The text also mentions gastrointestinal anthrax.
Yeah, gastrointestinal anthrax is rare, but it can occur from eating contaminated meat.
Eating contaminated meat.
Yeah, and it can lead to severe abdominal pain, vomiting, bloody diarrhea, and even perforation of the intestines.
So like a hole in the intestines.
Exactly.
Okay, let's break down the symptoms of each form of anthrax. What does cutaneous anthrax look like?
It typically starts as a painless lesion that looks like a small bump or a pimple, and this lesion then develops into a black, necrotic ulcer surrounded by swelling.
So like a black sore.
Yeah, a black sore. Thankfully, cutaneous anthrax is usually treatable with antibiotics if it's caught early.
Okay, and what about inhalation anthrax? What are the warning signs for that one?
Inhalation anthrax initially presents with flu-like symptoms like fever, cough, and chest pain. However, it can rapidly progress to severe respiratory distress, shock, and even death if it's not treated promptly.
So it can go downhill really quickly. And gastrointestinal anthrax.
Gastrointestinal anthrax can cause a range of symptoms, from nausea and vomiting to bloody diarrhea and severe abdominal pain.
So if someone suspects they might have anthrax, what should they do?
Seek immediate medical attention. It's a serious infection that requires prompt treatment with antibiotics.
And what about prevention? Is there a vaccine for anthrax?
There is a vaccine available, but it's typically reserved for people at high risk of exposure, like military personnel or those who work with animals or animal products.
Makes sense. Well, that's a lot to take in about anthrax. Let's move on to a disease that might make you think twice about your next seafood buffet. Cholera.
Cholera, yeah.
It always seems to be associated with, like, contaminated water sources.
Cholera is a diarrheal disease caused by the bacterium Vibrio cholerae. And you're right, it's often associated with contaminated water sources, and it can spread rapidly in areas with poor sanitation.
Right, makes sense. The text describes the diarrhea as rice water diarrhea. What does that even mean?
It's a rather descriptive term for the watery diarrhea that's characteristic of cholera. It's often so profuse and severe that it can lead to rapid dehydration and electrolyte imbalances.
So you're losing fluids really quickly. And that dehydration can be life-threatening, right?
Absolutely. Dehydration is the most serious complication of cholera. It can lead to shock, organ failure, and death if it's not addressed promptly.
So how is cholera diagnosed and treated?
Diagnosis is typically made through stool culture, where we take a sample of the stool and examine it in a lab to identify the presence of Vibrio cholerae.
And the treatment?
The cornerstone of cholera treatment is rehydration. This involves replacing the lost fluids and electrolytes.
So that means giving them fluids either orally or intravenously.
Exactly, depending on the severity of the dehydration.
Can antibiotics help shorten the course of the illness?
They can be used, but they're secondary to rehydration therapy.
So rehydration is the priority.
Always. The text mentions tetracycline, ampicillin, and trimethoprim sulfamethoxazole as possible options for antibiotics.
Okay, big words.
But antibiotic resistance is a concern, so susceptibility testing is often done to make sure that we're using the most effective antibiotic.
Makes sense. What about prevention? What steps can people take to avoid cholera?
The key is to avoid consuming contaminated food and water. So, practicing good hygiene, washing hands thoroughly, drinking only bottled or boiled water in areas where cholera is common, and being cautious about the seafood you consume, especially in areas with poor sanitation.
Right, those are all really good points. The text also mentions a cholera vaccine.
Yes, there's a vaccine available that can provide some protection against cholera. It's particularly recommended for travelers to areas where cholera is endemic.
So if you're traveling to a place where cholera is common, definitely talk to your doctor about getting that vaccine.
Exactly.
Okay, now that we've covered cholera, let's talk about a disease that might make you think twice about stepping on a rusty nail.
Tetanus.
Oh, tetanus. That's a classic.
I remember, as a kid, if you got a cut or a scrape, your parents would always be like, make sure you get your tetanus shot.
It's a bacterial infection caused by Clostridium tetani. and it's commonly found in soil, dust, and manure.
So, like, everywhere.
It is pretty ubiquitous. The text describes tetanus as a ubiquitous neurotoxin. What does that even mean?
Ubiquitous means it's found everywhere, like you said. And the neurotoxin part refers to the fact that the bacteria produces a toxin that attacks the nervous system.
And that causes those severe muscle spasms.
Exactly.
So stepping on a rusty nail is just one way you can get tetanus.
That's a common way people think about it, but any puncture wound, burn, or even a minor scratch can potentially become infected with tetanus if it's contaminated with the bacteria.
So really, any opening in the skin could be an entry point for those bacteria.
Exactly. It's all about whether the bacteria gets in.
What are some of the early signs of tetanus?
Well, the initial symptoms often involve pain and tingling at the site of the wound. And then as the toxin starts to affect the nervous system, you'll see muscle spasticity, stiffness.
And I remember hearing about lockjaw as a classic symptom of tetanus.
Yes, lockjaw or trismus is a hallmark symptom. It's a painful spasm of the jaw muscles that makes it difficult to open the mouth.
So your jaw's like locked shut.
Pretty much. And if it's left untreated, those muscle spasms can become incredibly severe. They can affect the muscles involved in breathing, and that can lead to respiratory failure.
So you can't breathe.
Yeah, convulsions and even death can occur in severe cases.
Wow. What's the treatment for tetanus?
Prompt treatment is crucial. If someone has a wound that's at risk for tetanus, they'll be given tetanus immune globulin to neutralize the toxin.
So they get a shot of antibodies?
Exactly, a shot of antibodies to fight the toxin directly, and they'll also receive a tetanus toxoid booster to help their body develop long-term immunity.
Okay.
Beyond that, treatment is largely supportive, focusing on managing those painful muscle spasms and supporting breathing if necessary.
The text emphasizes that prevention is the best approach when it comes to tetanus.
Absolutely. Active immunization, starting in childhood, is highly effective in preventing tetanus. The tetanus vaccine is typically given as part of the DTaP vaccine.
DTaP.
Yeah, which also protects against diphtheria and pertussis.
So those childhood vaccinations are really important.
Incredibly important for building up that immunity to tetanus. And boosters are recommended every 10 years to maintain immunity.
Okay, good to know. Let's move on to another foodborne illness that can cause a whole lot of discomfort. Salmonellosis.
Salmonella.
I think we've all heard horror stories about salmonella outbreaks. You know, like you go to a picnic and the potato salad's been sitting out in the sun too long, and the next thing you know, everybody's sick.
It's definitely not a picnic you want to be a part of.
No.
Salmonellosis is a bacterial infection caused by Salmonella bacteria, and there are actually over 2,000 different types of Salmonella.
Wow, 2,000.
But they all share a common mode of transmission: contaminated food or water.
Okay, so it's all about food safety. What are the typical signs of salmonellosis?
The most common symptoms are nausea, vomiting, abdominal cramps, and diarrhea. Fever is also common.
Sounds pretty miserable. How long does it usually last?
Most cases of salmonellosis actually resolve on their own within a few days. However, some people may develop more severe illness and require medical attention.
Okay. The text mentions different patterns of salmonellosis, including gastroenteritis, enteric fever, and bacteremia. What's the difference between those?
Gastroenteritis is the most common form, and it's basically what we think of as food poisoning.
Okay.
Enteric fever is more serious. It involves a prolonged fever, headache, and abdominal pain. And it can even lead to complications like intestinal bleeding and perforation.
And bacteremia.
Bacteremia is when the bacteria enters the bloodstream.
Oh, that doesn't sound good.
No, it's not. And this can lead to infections in other parts of the body, like the bones, joints, and even the heart.
The text mentions that treatment for salmonellosis depends on the severity and the specific type of infection.
That's right. For uncomplicated gastroenteritis, supportive care with fluids and rest is usually sufficient. But for more severe cases, or for those at risk of complications, antibiotics may be necessary.
Okay. And as with most foodborne illnesses, prevention is key.
Absolutely. Safe food handling practices are crucial. This includes washing hands thoroughly before and after handling food, cooking food to the proper temperature, refrigerating leftovers promptly, and avoiding cross-contamination between raw and cooked foods.
All those good food safety tips that we've all heard, but it's good to be reminded of them.
Huh?
Okay, let's talk about another intestinal infection that can cause a lot of discomfort. Shigellosis.
Shigellosis, that's another fun one.
It's another diarrheal disease, right?
It is. It's caused by Shigella bacteria. And like Salmonella, it's often spread through contaminated food or water, and it can spread rapidly in places with poor sanitation.
The text describes Shigella as a particularly nasty bug that can cause bloody diarrhea and prolonged fevers.
Yeah, it can be a nasty one. And the text also mentions that it has a low infectious dose.
Low infectious dose, what does that mean?
It means it doesn't take many bacteria to cause illness.
Oh, that's concerning. So what happens when someone gets infected with Shigella?
The bacteria typically invade the lining of the intestines, and they cause inflammation and damage. And this leads to those characteristic symptoms of shigellosis:
Which are?
abdominal cramps, fever, and diarrhea, which can be watery or bloody.
How is shigellosis diagnosed?
Diagnosis is usually based on the symptoms and confirmed through a stool culture, where we examine a sample of stool in a lab to identify the presence of Shigella bacteria.
And what about treatment?
Treatment typically involves antibiotics, but the choice of antibiotic depends on the severity of the infection and local resistance patterns.
So it's not a one-size-fits-all approach.
No, not at all. And in some cases, supportive care with fluids and electrolytes may be sufficient.
What can people do to prevent shigellosis?
The key is to avoid consuming contaminated food and water. So again, practicing good hygiene, washing hands thoroughly, drinking only bottled or boiled water in areas where shigellosis is common, and being cautious about food preparation, especially in places with poor sanitation.
All those good food safety tips again. Okay. Next on our list is a bacterial infection that can cause a thick coating in the back of the throat, diphtheria. I remember learning about this one in history class, but I don't actually know that much about it.
Diphtheria. It's caused by the bacterium Corynebacterium diphtheria, and it's known for producing a toxin that can cause this thick, grayish membrane to form in the back of the throat.
Oh, so it's not just a sore throat. It can actually block the airway.
It can. That membrane can obstruct the airway, making it difficult to breathe. And the toxin can also damage the heart and nerves, leading to serious complications.
How is diphtheria spread?
It's primarily spread through respiratory droplets, so coughing or sneezing can transmit the bacteria.
So like being in close proximity to someone who's infected.
Right.
What are the typical symptoms?
It usually starts with a sore throat, fever, and swollen lymph nodes. And then that characteristic grayish membrane starts to form in the throat, and that's what can cause difficulty breathing and swallowing.
The text emphasizes that prompt treatment is critical for diphtheria. What does treatment involve?
Treatment involves administering diphtheria antitoxin. This helps to neutralize the toxin and prevent further damage. Antibiotics are also given to kill the bacteria.
And there's a vaccine for diphtheria, right?
Yes, the diphtheria vaccine is highly effective in preventing the disease. It's typically given as part of the DTaP vaccine in childhood, with boosters recommended throughout life.
Okay, let's move on to a disease that's known for its signature whoop sound. Pertussis, also known as whooping cough. I've heard recordings of this cough and it sounds really scary.
It can be. Pertussis is a highly contagious respiratory illness caused by the bacterium Bordetella pertussis.
And it's particularly dangerous for infants and young children, right?
It is. It can lead to serious breathing problems in those age groups. The text mentions that even though there's been a significant decrease in cases due to widespread vaccination, pertussis remains a global health concern.
Oh, really? I would have thought the vaccine would have taken care of it.
Well, vaccination rates aren't consistent worldwide, and immunity from the vaccine can wane over time. This creates opportunities for outbreaks to occur.
So it's a reminder that we can't become complacent about vaccination.
Exactly. Vaccination is crucial for protecting vulnerable populations.
The text mentions that pertussis infection is most dangerous in infants and those with pre-existing conditions like heart or lung disease. Why is that?
Their immune systems may not be as robust, and their respiratory systems are more vulnerable to the effects of the disease.
So it hits them harder. So how does pertussis typically progress?
It typically progresses in 3 stages. The first stage, the catarrhal stage, resembles a common cold with sneezing, runny nose, and a mild cough.
Okay, sounds pretty normal.
Yeah, but then comes the paroxysmal stage. That's where the characteristic whoop comes into play. The cough becomes much more severe, occurring in these intense, uncontrollable bursts. These coughing fits are often followed by a whooping sound as the person struggles to catch their breath. They can be so intense that they lead to vomiting and exhaustion.
Wow, so that's where the name whooping cough comes from.
Exactly. And then the third stage, the convalescent stage, is marked by a gradual decrease in coughing, although the cough can linger for weeks or even months.
Oh, wow. So it can really drag on. The text mentions that diagnosis is usually based on clinical presentation, but it can be confirmed through cultures or PCR testing.
Yeah, that whooping cough is often pretty distinctive.
It's pretty unique.
But lab tests can help to confirm the diagnosis, especially in cases where the presentation is atypical.
Okay, so when it's not a clear-cut case, how is pertussis treated?
Antibiotics are the mainstay of treatment.
To kill those bacteria.
Yeah, they help to reduce the severity and duration of the cough, and they also prevent the spread of the bacteria to others.
So you're less contagious. The text recommends macrolide antibiotics as the first-line treatment.
That's right. Macrolides, such as azithromycin, are typically the preferred choice.
Okay. And what about supportive care? Is there anything else that can be done to help people who are suffering from pertussis?
Yeah, supportive care is important too, especially for infants and young children. This might involve humidified air to ease breathing, suctioning to clear the airway, and ensuring adequate hydration.
So like keeping them comfortable and making sure they're getting enough fluids.
Exactly.
And as always, prevention is key, right?
Absolutely. The pertussis vaccine is very effective in preventing the disease. It's given as part of the DTaP vaccine in childhood, with boosters recommended throughout life.
Okay, great. Now let's switch gears and dive into the fascinating world of viruses. First up, the infamous Epstein-Barr virus, or EDV for short. I remember having mono in college, and I heard that's caused by EBV.
EBV is a member of the herpes virus family, and it's incredibly common. In fact, most people are infected with EBV at some point in their lives.
Really? I didn't realize it was that common.
It is.
The text says it's transmitted through saliva, which is how it got the nickname the kissing disease.
That's right. It's often spread through close contact, like kissing or sharing utensils.
So if most people get infected with EBV, why don't we all get mono?
Most EBV infections are actually mild, and they often go unnoticed, especially in young children.
Okay.
But when infection occurs during adolescence or young adulthood, it's more likely to cause infectious mononucleosis, or mono.
Ah, so that's why I got hit with it in college. What are the classic symptoms of mono?
The hallmark symptom is extreme fatigue.
Fatigue's like being tired.
It's not just feeling tired, it's a debilitating fatigue that can last for weeks or even months. Other symptoms include fever, sore throat, swollen lymph nodes, and sometimes an enlarged spleen.
The text also mentions that EBV has been implicated in some cancers.
Yes, EBV has been linked to certain types of lymphoma, nasopharyngeal carcinoma, and even some gastric cancers.
So that's cancer of the nose and throat and stomach cancer.
That's right. However, it's important to note that EBV infection is very common, and only a very small percentage of infected individuals will develop these cancers.
So it's not a guarantee that having EBV will lead to cancer, but it does increase the risk.
Right. It's one of many factors that can contribute to the development of those cancers.
How is EBV diagnosed?
Diagnosis is usually clinical, based on the symptoms and the physical exam findings. Blood tests can confirm the presence of EBV antibodies, but they're not always necessary.
And is there a treatment for EBV?
Unfortunately, there's no specific antiviral treatment for EBV. Treatment is supportive, focusing on relieving symptoms and allowing the body to fight off the infection.
So it's all about rest, fluids, and over-the-counter pain relievers.
Exactly. And avoiding contact sports is important if the spleen is enlarged because it can be more susceptible to rupture.
Oh, wow, I didn't know that.
Yeah.
Okay. Next up is a virus that's known for causing quite a range of issues, from warts to more serious conditions. Let's talk about human papillomavirus, or HPV.
HPV is actually a group of over 100 different viruses.
Over 100 different viruses.
Some are harmless, while others can cause warts and even certain types of cancer.
The text describes HPV as non-enveloped icosahedral virions. What does that even mean?
That's just a fancy way of describing the structure of the virus.
Okay, let's stick with plain English. So, how is HPV spread?
HPV is primarily spread through skin-to-skin contact, including sexual contact.
Okay.
It's incredibly common, and most sexually active individuals are exposed to at least one type of HPV at some point in their lives.
Wow. Let's talk about warts first. What are those exactly?
Warts are benign growths on the skin, and they're caused by certain types of HPV. They're usually harmless, but they can be unsightly and sometimes painful.
The text describes them as benign growths on the skin caused by certain types of HPV.
Right, and they come in all shapes and sizes. Flat, raised, smooth, rough, you name it.
So it's not just one type of wart.
No, there are lots of different kinds.
And then there's the more concerning aspect of HPV. It's linked to cancer.
Certain strains of HPV, particularly HPV types 16 and 18, are strongly associated with cervical cancer. Other HPV types have been linked to cancers of the vulva, vagina, penis, anus, and throat.
It's a lot of different cancers.
Mm.
Luckily, we have a vaccine to protect against HPV, right?
Yes, the HPV vaccine is highly effective in preventing infection with the HPV types that are most commonly associated with cancer. It's recommended for both boys and girls, ideally before they become sexually active.
So that's an important vaccine to get. Moving on to a virus that's no stranger to most of us, the one responsible for those pesky cold sores, herpes simplex virus, or HSV. I think I've had my fair share of those.
HSV is another member of the herpes virus family, and like its cousin EBV, it's incredibly common.
Okay. And once you're infected with HSV, the virus stays in your body for life, right?
Unfortunately, yes.
The text explains that HSV has two main types, HSV1 and HSV2. What's the difference between those?
HSV1 is typically associated with oral herpes, so that's what causes those classic cold sores around the mouth. HSV2, on the other hand, is usually responsible for genital herpes.
So one's oral and one's genital,
Right.
but both can infect either area, right?
That's right. HSV1 can be spread through oral contact, even to the genitals, and HSV2 can be spread through genital contact to the mouth.
Okay, so you have to be really careful.
You do. And HSV has a nasty habit of sticking around, doesn't it?
Yeah, it does. The text mentions that the virus lies dormant in nerve cells and periodically reactivates to cause outbreaks.
Unfortunately, yes. Once you have HSV, it's there to stay. It can lie dormant for long periods, but certain triggers can cause it to reactivate, leading to those outbreaks of blisters and sores.
What kinds of things can trigger those outbreaks?
A variety of factors can reactivate the virus. Things like stress, illness, fatigue, and even sun exposure can trigger outbreaks.
So it's kind of like it's just waiting for opportunity to strike.
Pretty much.
And those outbreaks are typically characterized by, like, painful blisters, right?
Yes, HSV causes those fluid-filled blisters that eventually rupture and form sores. The first outbreak is usually the most severe, with subsequent outbreaks tending to be milder and less frequent.
Okay. So it gets better over time. How is HSV diagnosed and treated?
Diagnosis is often clinical, based on the appearance of those characteristic blisters. Lab tests can confirm the diagnosis, but they aren't always necessary. And for treatment, we have antiviral medications. Acyclovir is a common one. These medications can help reduce the severity and duration of outbreaks, and they can also be taken daily to suppress outbreaks in people who experience them frequently.
Okay. Let's talk about HSV in pregnancy. The text mentions that it can be particularly dangerous for both the mother and the infant.
That's because a primary HSV infection during pregnancy carries a high risk of transmission to the baby, and that can lead to serious complications.
What are the potential complications for the baby?
For the baby, HSV infection can cause disseminated disease, which means it spreads throughout the body. This can lead to brain damage, blindness, and even death.
Oh, wow. And for the mother?
For the mother, a primary infection during pregnancy increases the risk of miscarriage and premature labor.
That's why regular prenatal care is so crucial.
Absolutely. Early detection and management of HSV in pregnant women can significantly reduce the risk of complications for both mother and child.
Okay. Let's move on to a virus that's sure to evoke some memories, especially during flu season. Influenza, better known as the flu.
The flu,
I think we've all had that at some point.
it's a highly contagious respiratory illness caused by the influenza virus, and it's responsible for those seasonal epidemics that sweep across the globe each year.
No, it's like clockwork. Every year, the flu comes around.
It's a virus that knows how to travel, and it can change its appearance too, which makes it a particularly challenging opponent.
The text describes influenza as an orthomyxovirus that's spread via droplets. What does that mean in plain English?
Orthomyxovirus is just a fancy scientific term for a particular family of viruses.
Okay.
What's important to know is that influenza spreads through those tiny droplets that are released when someone coughs or sneezes.
Okay, so like when you sneeze and those little droplets go flying through the air.
Exactly, and those droplets can travel through the air and infect anyone who inhales them.
So it's like those virus particles are hitchhiking on those droplets, looking for a new host.
That's a great way to put it.
And there are actually different types of influenza viruses, right?
Right.
The text mentions types A, B, and C. Are some worse than others?
Types A and B are the main culprits behind those seasonal flu epidemics that we experience each year. Type C typically causes milder illnesses, so we don't hear about it as much.
Okay, so A and B are the ones to watch out for. I remember a few years back there was a lot of concern about avian influenza or bird flu. What was that all about?
Avian influenza, or bird flu, is a type of influenza, a virus that primarily affects birds.
Birds.
Yeah. But certain strains can jump species and infect humans.
Oh, no.
And those can be particularly dangerous.
The text mentions a specific subtype, H5N1, that caused a lot of concern.
Yeah, H5N1 was a real wake-up call. It had a high mortality rate in humans, meaning a lot of people who got infected died. Thankfully, human-to-human transmission was limited, but it highlighted the potential for avian influenza viruses to trigger a global pandemic.
So it's a reminder that these viruses are constantly evolving, and we need to be prepared for those unexpected jumps between species.
Exactly. We need to be vigilant about surveillance and early detection to stay one step ahead of these viruses.
Okay. Let's talk about the symptoms of the flu. What are the telltale signs that you've been struck by this virus?
The flu usually hits you pretty suddenly. You get a fever, often quite high, accompanied by chills, muscle aches, headache, and fatigue. A cough, sore throat, and runny nose are also common.
It sounds like a recipe for a few days in bed. Is the flu usually dangerous, or is it just like a really bad cold?
Most people recover from the flu within a week or two without any lasting complications. But for some people, especially young children, older adults, and those with underlying health conditions, the flu can be much more serious.
What kind of complications are we talking about?
Pneumonia is a common complication, and it can be life-threatening, especially in those with weakened immune systems or chronic lung diseases. The flu can also trigger ear infections, sinus infections, and even inflammation of the heart muscle, known as myocarditis.
The text also mentions a scary-sounding complication called Reye syndrome.
Reye syndrome is a rare but serious neurological disorder that can affect the brain and liver. It's most often seen in children and adolescents who have had a recent viral infection, particularly influenza or chickenpox.
What causes Reye syndrome?
The exact cause is unknown, but there's a strong association between Reye syndrome and the use of aspirin during viral illnesses.
Aspirin?
Yeah, that's why it's crucial to avoid giving aspirin to children and teenagers who have the flu or chickenpox.
So no aspirin for kids with the flu or chickenpox?
Exactly. Use something else like acetaminophen or ibuprofen.
Got it. So what's the best way to diagnose the flu?
Diagnosis is usually based on the symptoms, especially during flu season when the virus is circulating widely. However, lab tests can confirm the diagnosis, especially if there's a need to differentiate influenza from other respiratory illnesses.
So if they need to be absolutely sure, and how is the flu treated?
For most people, treatment involves rest, fluids, and over-the-counter medications to manage the symptoms.
So like fever reducers and pain relievers.
Exactly.
But I've heard about antiviral medications for the flu.
Yes, antiviral medications can help shorten the duration of the illness and reduce the severity of symptoms. They're most effective when started within 48 hours of symptom onset, so early diagnosis is important.
So if you think you might have the flu, get to the doctor quickly.
Exactly.
And of course, we can't forget about the flu shot.
The influenza vaccine is the best way to prevent the flu, and it's recommended for everyone over 6 months of age. The vaccine is updated each year to target the circulating strains of influenza.
So it's like an annual tune-up for our immune system to help us fight off those flu viruses.
That's a great way to think about it.
Okay, next up is a virus that causes a very distinct rash. Varicella zoster virus, better known as chickenpox.
Chickenpox. I remember having chickenpox as a kid. Definitely not a fun experience.
It's one of those childhood illnesses that most people go through.
It is. It's highly contagious, and it's known for its itchy, blistering rash.
Yeah, I remember those blisters. It's usually a mild illness in children, right?
Right, but it can be more severe in adults and in people with weakened immune systems. The text mentions that VZV is a member of the herpes virus family, so it sticks around for life, much like HSV.
Oh, really? So you can get chickenpox as a child and then shingles as an adult.
That's right. Shingles is caused by the same virus as chickenpox, but it manifests differently.
Okay, let's talk about the chickenpox rash first. What does that look like?
It starts as small red bumps that quickly develop into fluid-filled blisters. The blisters eventually rupture and form scabs. The text mentions that the lesions appear in crocs, which means that new lesions appear in waves, so you'll have blisters at different stages of development all at the same time.
And these blisters can appear all over the body, right?
Yes, they can be found on the scalp, face, trunk, limbs, and even inside the mouth.
And they're incredibly itchy, right?
They are. The itching can be very intense.
I remember the itching being the worst part. Are there any complications associated with chickenpox?
In most cases, chickenpox runs its course without any serious problems, but it can sometimes lead to complications, especially in adults, immunocompromised individuals, and pregnant women.
What kind of complications can occur?
Bacterial skin infections are a common complication as those open blisters can become infected. Pneumonia, encephalitis, and hepatitis are less common, but more serious complications. And as we discussed earlier, Ray's syndrome is a rare but serious complication that can occur in children and adolescents who take aspirin during a varicella infection.
So what's the treatment for chickenpox?
Treatment is usually supportive, focusing on relieving the itch and preventing secondary bacterial infections. Calamine lotion can help soothe the itch, and keeping the fingernails short can help prevent scratching, which can lead to scarring.
So it's all about managing the symptoms and keeping those blisters clean. And thankfully, we have a vaccine to prevent chickenpox, right?
Yes, the varicella vaccine is highly effective in preventing chickenpox. It's given to children as part of the routine childhood immunization schedule, and it's also recommended for adults who haven't had chickenpox.
And what about shingles? Is there a vaccine for that too?
Yes, there's a vaccine specifically for shingles called Shingrix. It's recommended for adults over 50 as the risk of shingles increases with age.
Okay, next up is a virus that can be transmitted from animals to humans.
Rah.
Rabies. This one always seems so terrifying because it's almost always fatal once symptoms appear.
Rabies is definitely a virus you don't want to mess with. It's a viral disease that affects the central nervous system, and as you mentioned, it's almost always fatal once symptoms develop.
The text mentions that rabies is transmitted through infected saliva, typically from an animal bite.
That's right. The virus enters the body through a break in the skin, usually from a bite or scratch from an infected animal. It then travels through the nerves to the brain, where it replicates and causes inflammation.
What animals are most commonly associated with rabies transmission?
Bats are a major reservoir for rabies in the United States. Other animals that can transmit rabies include raccoons, skunks, foxes, and coyotes.
So if you're bitten or scratched by one of these animals, it's important to seek medical attention immediately.
Absolutely. Prompt treatment after a potential exposure is crucial.
What are the symptoms of rabies?
The initial symptoms are often flu-like, fever, headache, muscle aches, and fatigue. But as the virus progresses, neurological symptoms develop, including anxiety, agitation, confusion, hallucinations, and even paralysis.
The text mentions hydrophobia as a classic symptom of rabies.
Hydrophobia is a fear of water, and it develops because the muscles involved in swallowing become paralyzed. The thought of swallowing, even saliva, can trigger painful spasms.
That's horrifying. So what happens if someone develops symptoms of rabies?
Unfortunately, once symptoms appear, rabies is almost always fatal. There is no effective treatment at that point.
That's why it's so important to get treatment right away after a potential exposure.
Exactly. If someone is bitten or scratched by an animal suspected of having rabies, they need to receive post-exposure prophylaxis, which includes a series of rabies vaccinations and rabies immune globulin.
And what if the animal that bit the person can't be found?
In those cases, it's safest to err on the side of caution and administer the post-exposure prophylaxis.
Okay, let's shift gears to a viral infection that affects the immune system. Human immunodeficiency virus, or HIV. This is a virus that's had a huge impact on global health.
It has. HIV is a retrovirus that attacks the immune system, specifically targeting the CD4 plus T cells. These are white blood cells that play a critical role in coordinating the body's immune response.
The text mentions that HIV was first recognized in 1981 when doctors identified a cluster of patients with unusual opportunistic infections.
That's right. These were infections that wouldn't normally cause serious illness in a healthy person, but in these patients, their immune systems were so weakened that these infections were becoming life-threatening.
How is HIV transmitted?
HIV is primarily spread through contact with infected bodily fluids, such as blood, semen, vaginal fluids, and breast milk. The most common modes of transmission are through sexual contact, sharing needles, and from mother to child during pregnancy, childbirth, or breastfeeding.
Okay, so there are multiple ways it can be transmitted. What are the typical signs and symptoms of HIV infection?
The initial infection can cause flu-like symptoms, such as fever, fatigue, swollen lymph nodes, and a rash. However, many people experience no symptoms at all during this early stage, known as acute HIV infection.
So someone could be infected with HIV and not even know it.
That's one of the challenges of HIV. It can silently replicate for years without causing any noticeable symptoms.
What happens if HIV is left untreated?
the virus continues to replicate and destroy CD4 plus T cells, leading to a progressive weakening of the immune system. This stage is known as chronic HIV infection.
And eventually, this progresses to AIDS.
Yes, acquired immunodeficiency syndrome, or AIDS, is the most advanced stage of HIV infection. It's defined by a CD4 plus T cell count below 200 cells L, or the development of certain opportunistic infections or cancers.
The text includes a table outlining AIDS-defining illnesses. It's quite a long list.
It highlights the wide range of infections and cancers that can take hold when the immune system is severely compromised by HIV.
How is HIV diagnosed?
The primary test for HIV is an antibody test, which detects the presence of antibodies to HIV in the blood. There are rapid tests that can provide results in minutes, as well as other tests that may take a few days.
And if the antibody test is positive?
A confirmatory test, such as a Western blot or an immunofluorescent assay, is performed to confirm the diagnosis.
Okay. Is there a cure for HIV?
Unfortunately, there's no cure for HIV yet, but we've made tremendous progress in managing the disease with antiretroviral therapy, or ART.
What does ART involve?
ART involves taking a combination of medications that target different stages of the HIV replication cycle. These medications can effectively suppress the virus, preventing the progression to AIDS and allowing people with HIV to live long and healthy lives.
That's encouraging. The text also mentions that prevention is crucial for ending the HIV epidemic.
Absolutely. Prevention efforts include educating people about HIV transmission and risk reduction strategies, promoting condom use, providing access to HIV testing and counseling, and expanding access to pre-exposure prophylaxis, or pre-P.
What is pre-P?
Pre-EP is a daily medication that can significantly reduce the risk of HIV infection. It's recommended for people who are at high risk of exposure to HIV, such as those who have partners who are HIV positive or who engage in high-risk sexual behaviors.
So it's like a preventative measure for those who are at increased risk.
Exactly. It's a powerful tool for preventing new HIV infections.
Okay, let's talk about another herpes virus. Cytomegalovirus, or CMV.
CMV is a very common virus. In fact, most people are infected with it at some point in their lives, often without even knowing it.
The text states that most CMV infections are asymptomatic. Why is that?
In healthy individuals, the immune system is usually able to keep the virus in check, preventing it from causing illness.
But CMV can cause problems in certain populations, right?
Yes, CMV can be a serious concern for infants who are infected in utero, as well as for people with weakened immune systems, such as those with HIV or transplant recipients.
What are some of the potential complications of CMV infection?
In infants, congenital CMV infection can cause a range of problems, including hearing loss, vision loss, intellectual disability, and microcephaly, which is a smaller than normal head size.
And in immunocompromised individuals?
CMV can reactivate and cause a variety of illnesses, including retinitis, which is an inflammation of the retina that can lead to vision loss, pneumonia, encephalitis, which is inflammation of the brain, and gastrointestinal ulcers.
So it's important to be aware of CMV and the potential risks it poses to certain populations.
Definitely. And there are antiviral medications that can be used to treat CMV infections, particularly in those who are immunocompromised.
Okay, now that we've covered some of the major bacterial and viral players, let's explore the fascinating world of fungal infections. First up, candidiasis. I think most people have heard of this one, at least in the context of yeast infections.
Candidiasis is a fungal infection caused by various species of Candida, with Candida albicans being the most common culprit.
The text describes Candida albicans as part of the normal flora of human hosts. What does that mean?
It means that these fungi normally live in and on our bodies without causing any problems. They're part of our microbiome, that diverse community of microorganisms that live in and on us.
So they're like microscopic roommates that usually coexist peacefully.
Exactly. But sometimes that peaceful coexistence can be disrupted.
What can cause Candida to turn from a friendly roommate into a troublemaker?
When the balance of the microbiome is disrupted or when the immune system is weakened, Candida can overgrow and cause infection.
So it's like they're taking advantage of a weakened system. What are some common types of candidiasis?
Candidiasis can affect various parts of the body. Diaper rash is a common term of cutaneous candidiasis that we often see in infants. Thrush, also known as oral candidiasis, causes white plaques on the tongue and inside of the mouth. And esophageal candidiasis affects the esophagus, causing pain and difficulty swallowing.
The text mentions several risk factors for developing candidiasis.
That's right. Things like a weakened immune system, certain medications such as antibiotics and corticosteroids, diabetes, and even pregnancy can increase the risk of candidiasis.
So it's a combination of factors that can tip the scales in favor of candida.
Yep.
How is candidiasis treated?
Treatment depends on the location and severity of the infection. Topical antifungal creams are often effective for cutaneous candidiasis. Oral antifungal medications such as fluconazole are typically used for thrush and esophageal candidiasis. And for severe or invasive infections, intravenous antifungal medications might be necessary.
Okay, so there's a range of treatment options depending on the specific situation. Let's talk about a fungal infection that's often associated with bird droppings. Histoplasmosis.
Histoplasmosis, that's one you don't want to get.
It's caused by the fungus Histoplasma capsulatum, which thrives in soil contaminated with bird or bat droppings.
Right, and it's more common in certain regions like the Ohio and Mississippi River valleys.
The text describes it as a dimorphic fungus, meaning it exists in two forms, mold and yeast. What does that mean?
Dimorphic just means that the fungus can switch between two different forms depending on its environment. In the soil, it exists as a mold, but when it's inhaled into the lungs, it transforms into a yeast form.
So it shapeshifts depending on where it is.
That's a great way to put it. And this ability to switch forms is actually part of what makes it so successful as a pathogen.
So how is histoplasmosis transmitted?
It's primarily transmitted through inhalation of the fungal spores. Activities that disrupt the soil, like construction or gardening, can increase the risk of exposure.
And what happens when those spores are inhaled into the lungs?
Most people who inhale the spores don't get sick at all, or they experience only mild flu-like symptoms that resolve on their own. However, in some cases, histoplasmosis can cause more serious illness, especially in people with weakened immune systems.
The text mentions three main clinical forms of histoplasmosis: acute pulmonary histoplasmosis, progressive disseminated histoplasmosis, and chronic pulmonary histoplasmosis. Can you break those down for us?
Sure, acute pulmonary histoplasmosis is the most common form, and it usually presents with flu-like symptoms: fever, cough, chest pain, and fatigue. Progressive disseminated histoplasmosis is a much more serious form, where the infection spreads from the lungs to other parts of the body, like the liver, spleen, and central nervous system. This form is most often seen in people with weakened immune systems. And chronic pulmonary histoplasmosis is a long-term infection that primarily affects the lungs and can cause progressive damage over time.
That's a lot of different ways histoplasmosis can manifest. How is it diagnosed and treated?
Diagnosis can be challenging, as the symptoms can mimic other respiratory illnesses. Lab tests, including cultures and blood tests, can confirm the diagnosis. Treatment typically involves antifungal medications, such as itraconazole or amphotericin B. The duration of treatment depends on the severity of the infection.
Okay, let's move on to another fungal infection that can affect the lungs. Cryptococcosis.
Cryptococcosis is caused by a fungus called Cryptococcus neoformans, which is typically found in soil contaminated with bird droppings, particularly pigeon droppings.
So watch out for those pigeons.
Right. The text describes it as an encapsulated yeast.
What does that mean?
The fungus has a protective capsule surrounding it, which helps it evade the immune system. This capsule acts like a shield, making it difficult for the body's immune cells to recognize and destroy the fungus.
So it's like the fungus has its own invisibility cloak.
That's a great analogy. And this ability to evade the immune system is part of what makes cryptococcosis a particularly challenging infection to treat, especially in people with weakened immune systems.
How is cryptococcosis transmitted?
It's transmitted through inhalation of the fungal spores. But here's the good news: it rarely causes illness in healthy individuals.
So who is most at risk of developing cryptococcosis?
People with weakened immune systems, such as those with HIV/AIDS, organ transplant recipients, and those on long-term corticosteroid therapy, are most susceptible to developing cryptococcosis.
What are the typical symptoms?
The most common presentation is pulmonary cryptococcosis, which can cause cough, chest pain, and shortness of breath. However, in some cases, the fungus can spread to other parts of the body, and the central nervous system is a particularly vulnerable target.
The text mentions cryptococcal meningitis is a serious complication.
Yes, cryptococcal meningitis is an infection of the meninges, which are the membranes that surround the brain and spinal cord. It can cause a range of symptoms, from headache and fever to stiff neck, nausea, vomiting, and altered mental status.
So it's a serious infection that requires prompt medical attention.
Absolutely. Early diagnosis and treatment are crucial for improving outcomes.
How is cryptococcosis diagnosed?
Diagnosis typically involves testing spinal fluid or blood for the presence of the fungus. Imaging studies, such as CT scans or MRIs, might also be used to visualize the infection.
And what about treatment?
Treatment usually involves a combination of antifungal medications. The choice of medications and the duration of treatment depend on the severity of the infection and the patient's immune status.
Okay. Next up is a fungal infection that's particularly concerning for people with weakened immune systems. Pneumocystis jirovecii pneumonia, or PJP.
PJP, formerly known as Pneumocystis carinii pneumonia, is an opportunistic infection caused by a fungus called Pneumocystis jirovecii, which is often found in the lungs of healthy people.
So it's already there, just waiting for a chance to strike.
Mm.
The text mentions that most people are exposed to this fungus during childhood, but a healthy immune system usually keeps it under control.
That's right. It's one of those microbes that coexists with us without causing any problems in most cases. But for people with weakened immune systems, Pneumocystis jirovecii can seize the opportunity to multiply and cause infection.
So who is most at risk of developing PJP?
People with compromised immune systems, particularly those with HIV/AIDS, are most susceptible to PJP. Other risk factors include organ transplantation, cancer chemotherapy, and the use of certain medications that suppress the immune system.
What are the typical symptoms?
The most common symptom is shortness of breath, which typically develops gradually and worsens over time. Other symptoms can include fever, dry cough, and fatigue.
How is PJP diagnosed and treated?
Diagnosis involves identifying the fungus in respiratory secretions or lung tissue. Chest x-rays or CT scans can also help visualize the infection in the lungs.
Okay, so imaging studies can play a role.
Right. And for treatment, the drug of choice for PJP is trimethoprim sulfamethoxazole, often referred to as TMP-SMX.
That's a mouthful. And what about prevention? Are there any ways to prevent PJP in people who are at increased risk?
Yes, for people with weakened immune systems, particularly those with HIV/AIDS, prophylactic treatment with TMP-SMX is often recommended to prevent PJP.
So it's like taking a daily medication to keep that fungus in check.
Exactly. It can be very effective in preventing PJP in those who are vulnerable to this infection.
Okay, we've covered a lot of ground in the bacterial and fungal world. Now let's dive into the diverse realm of parasitic infections. First up, a parasite that might make you think twice about drinking water in certain parts of the world, amoebiasis.
Amoebiasis is an infection caused by a single-celled parasite called Entamoeba histolytica. It's often spread through contaminated food or water, and it's most common in tropical and subtropical regions with poor sanitation.
The text mentions that these amoebas can survive in the soil and water for months. That's pretty impressive.
They're incredibly resilient. They can withstand harsh conditions until they find a suitable host to infect.
And what happens when those amoebas make their way into the human body?
Well, it can be a silent invasion with no symptoms at all. But in other cases, it can lead to a range of intestinal issues, from mild diarrhea to severe dysentery, which involves bloody diarrhea and abdominal cramps.
The text describes amoebic colitis as a common manifestation of amoebiasis. What exactly is that?
Amoebic colitis is an inflammation of the colon caused by the amoebas invading the lining of the colon. This can lead to those symptoms like abdominal pain, cramping, and bloody diarrhea that we talked about.
And this can lead to complications, right?
Yes. In severe cases, amoebic colitis can lead to complications like intestinal perforation, where a hole develops in the wall of the intestine, and liver abscesses.
Liver abscesses. So this little parasite can actually migrate from the intestines to the liver.
It can. That's one of the more concerning aspects of amoebiasis. The amoebas can travel through the bloodstream from the intestines to other organs, and the liver is a common target.
How are amoebic liver abscesses diagnosed and treated?
Diagnosis often involves imaging studies like ultrasound or CT scans to visualize the abscess. Treatment typically involves a combination of medications to kill the parasite and sometimes a procedure to drain the abscess.
And how is amoebiasis diagnosed in general?
Diagnosis typically involves examining stool samples for the presence of the parasite or its cysts.
And the treatment?
Treatment involves anti-parasitic medications to target the amoebas. There are several effective medications available, and the choice depends on the severity of the infection.
What about prevention? What can people do to avoid getting amoebiasis?
The key is to avoid consuming contaminated food and water. This means practicing good hygiene, washing hands thoroughly, drinking only bottled or boiled water in areas where amoebiasis is common, and being cautious about consuming fruits and vegetables that may have been washed with contaminated water.
All those good food and water safety tips again. Okay, let's move on to another parasite that might make you squirm a little. Hookworm.
Hookworm. Ugh, I hate those things.
I know, they sound pretty creepy.
They are. Hookworm is a type of parasitic roundworm that lives in the small intestine of humans. It's often found in warm, moist climates where sanitation is poor.
The text mentions that hookworm larvae can actually penetrate the skin.
They can. Imagine these tiny creatures burrowing into your skin, usually through bare feet.
That's both fascinating and a little disturbing. What happens once those larvae get inside the body?
They migrate through the bloodstream to the lungs, where they mature, and then they make their way up the trachea to be swallowed. Eventually, they reach the small intestine, where they latch onto the intestinal wall and begin feeding on blood.
So they take a rather roundabout journey to get to their destination. What are the symptoms of hookworm infection?
The initial infection can cause an itchy red rash at the site where the larva penetrated the skin. This is often referred to as ground itch. Once the worms reach the intestines, they can cause a range of symptoms, including abdominal pain, diarrhea, and anemia.
Anemia. Why does hookworm infection lead to anemia?
Hookworms feed on blood, so a heavy infestation can lead to significant blood loss, resulting in iron deficiency anemia.
So they're literally draining your blood.
They are.
How is hookworm infection diagnosed?
Diagnosis is typically made by identifying hookworm eggs in a stool sample.
And the treatment?
Treatment involves anti-parasitic medications to kill the worms.
What about prevention? How can people protect themselves from hookworm?
Wearing shoes in areas where hookworm is common is one of the simplest but most effective ways to prevent infection. Other preventative measures include practicing good hygiene, properly disposing of human waste, and avoiding contact with contaminated soil.
Okay, next up is a parasitic infection that's particularly common in children. Pinworms, also known as enterobiasis. I remember having these as a kid. Not fun.
Pinworms are tiny, white parasitic worms that live in the intestines of humans. They're incredibly common, especially in children, and they can spread easily in crowded settings like schools and daycare centers.
The text mentions that humans are the only host for this particular parasite, so at least we don't have to worry about catching it from our pets.
That's right. Pinworms are strictly a human parasite.
How are pinworms spread?
They are spread through a fecal-oral route. This means that the microscopic pinworm eggs are shed in the feces of an infected person, and then someone else ingests those eggs, usually through contaminated hands, food, or surfaces.
So it's all about good hygiene to prevent the spread of pinworms.
Exactly. Hand washing is crucial. Those pinworm eggs can survive for days on surfaces, so it's important to wash hands thoroughly after using the bathroom, before eating, and after changing diapers.
What are the symptoms of a pinworm infection?
The most common symptom is intense itching around the anus, particularly at night. This is because the female pinworms migrate out of the anus at night to lay their eggs, causing irritation.
I can imagine that's not a pleasant sensation. How is pinworm infection diagnosed?
Diagnosis is often made by observing the worms or their eggs. A simple tape test where a piece of transparent tape is applied to the anal area and then examined under a microscope can reveal the presence of pinworm eggs.
So it's a pretty straightforward diagnosis, and how is it treated?
Treatment typically involves anti-parasitic medications, which are effective in killing the worms. Often, the entire household is treated to prevent reinfection.
And what about prevention? What else can be done to prevent the spread of pinworms?
In addition to hand washing, keeping fingernails short can help prevent scratching, which can spread the eggs. Frequent cleaning of surfaces, especially in bathrooms and bedrooms, can also help reduce the risk of transmission.
All right, our final parasitic foe for today is one that's known for causing a debilitating cyclical fever: malaria.
Malaria is a mosquito-borne disease caused by a parasite called Plasmodium. It's one of the most prevalent and deadly parasitic diseases worldwide, affecting millions of people each year, particularly in tropical and subtropical regions.
The text mentions several different species of Plasmodium that can cause malaria.
There are 4 main species that infect humans: Plasmodium falciparum, Plasmodium vivax, Plasmodium ovale, and Plasmodium malaria.
Are some species more dangerous than others?
Plasmodium falciparum is the most dangerous species. It causes the most severe form of malaria and is responsible for most malaria-related deaths.
And malaria is spread through the bite of infected mosquitoes, right?
Yes, specifically the bite of infected female Anopheles mosquitoes. These mosquitoes thrive in warm, humid climates, and they typically bite at night.
So what happens when an infected mosquito bites a human?
The parasite enters the bloodstream and travels to the liver, where it multiplies. After a period of time, which varies depending on the Plasmodium species, the parasites are released from the liver and infect red blood cells. This is when the symptoms of malaria typically start.
And those symptoms are known for their cyclical nature, right?
Yes, the classic malaria symptoms come in waves or episodes, typically lasting 6 to 12 hours. These episodes often occur every 48 to 72 hours, depending on the specific Plasmodium species involved.
What are the different stages of a malaria episode?
A typical episode involves 3 stages: the cold stage, the hot stage, and the sweating stage.
Okay, break those down for me. What happens during the cold stage?
The cold stage begins with chills and shivering, as if the person has suddenly been plunged into icy water.
And then comes the hot stage.
The hot stage is characterized by a high fever, often reaching 104 Fahrenheit or higher. Headache, vomiting, and muscle aches are also common during this stage.
And the sweating stage.
The sweating stage involves profuse sweating as the fever breaks and the body temperature returns to normal. The person often feels exhausted and weak after a malaria episode.
The text mentions that between these attacks, patients often feel fatigued. Why is that?
The parasite is destroying red blood cells, which carry oxygen throughout the body. This leads to anemia, which can cause fatigue, weakness, and shortness of breath.
And malaria can lead to serious complications, right?
Yes, if left untreated, malaria can be life-threatening. Severe malaria can cause organ damage, coma, and even death.
What are some of the potential complications of severe malaria?
Cerebral malaria is one of the most serious complications. It occurs when the parasite infects the brain, causing seizures, coma, and neurological damage. Other complications can include acute kidney failure, severe anemia, respiratory distress, and shock.
So prompt diagnosis and treatment are crucial for preventing these complications.
Absolutely. Early intervention can be life-saving.
How is malaria diagnosed?
Diagnosis is typically made by examining a blood smear under a microscope. The presence of the Plasmodium parasite inside red blood cells confirms the diagnosis.
And the treatment?
Treatment involves anti-malarial medications to kill the parasite. The choice of medication depends on the severity of the infection, the specific Plasmodium species involved, and the region where the infection was acquired.
What about prevention? What steps can people take to protect themselves from malaria?
Preventing mosquito bites is the most effective way to prevent malaria. This involves using insect repellent, wearing long sleeves and pants, especially during dawn and dusk when mosquitoes are most active, sleeping under mosquito nets, and using insecticide-treated bed nets.
And for those traveling to malaria-endemic areas, are there any additional preventative measures?
Yes, for travelers, chemoprophylaxis is highly recommended. This involves taking anti-malarial medication before, during, and after travel to prevent infection. The choice of medication depends on the specific travel destination and the individual's health history. It's essential to consult with a healthcare professional to determine the most appropriate chemoprophylaxis regimen.
That makes sense. So it's like a preemptive strike against those malaria parasites.
Exactly. It helps reduce the risk of infection while traveling in areas where malaria is prevalent.
Well, we've certainly journeyed through a microscopic jungle of infections today. It's incredible to think about all these tiny organisms that can have such a big impact on our health.
It's a hidden world that we often take for granted until we experience the effects of these microbes firsthand.
But I think it's safe to say we've armed you with a solid foundation of knowledge about these microbial invaders. Remember, knowledge is power, especially when it comes to your health.
Absolutely. Understanding how these infections spread, recognizing their symptoms, and knowing about available treatments can empower you to protect yourself and those around you.
So, as you navigate the world, be mindful of those microscopic hitchhikers, practice good hygiene, and seek prompt medical care when needed. Thanks for joining us on this deep dive into the world of infectious diseases. Until next time, stay curious and stay healthy.